So good evening. My name is Ruth Schwendinger. I get to work at Prevention Network. And you're joining us here for the capacity building workshop with Doreen Turk-White. Doreen is our expert guest tonight. So she's going to talk to us about the foundations of prevention in Michigan. And we've got a fantastic presentation prepared for you. Doreen, would you like to introduce yourself? And we can probably go around since there's about a dozen of us on the call. I will pause the recording while everybody else introduces themselves.
All right. I am, like she said, Doreen Turk-White. I'm the executive director of the Empowerment Zone Coalition and also we've been fortunate enough to get a DFC grant to replicate ourselves. I'm a health educator by trade. I have a master's in community and clinical health. And I'm a certified health education specialist. I've been doing health education, public health, over 40 years. Past 32 years, I've been building coalitions around substance abuse prevention. Hopefully I can impart some knowledge to you and you can impart some knowledge to me. Ruth calls me an expert. I don't see myself as an expert. I just see myself as a person who is committed to my community to try to do something better. I try to do whatever I can to learn to be able to do that. And sometimes you have to be real innovative to do that. So that's just a little bit about me. You'll probably find out a little bit more about me as we go along.
Thank you. So
there's a lot of us in the field that have did some things. Yes, we've made some mistakes. We've made errors. And so if we can head you off from doing those same errors that we did, we'd be happy to do that. Have to be persistent when you're doing capacity building and coalition building. Bring up my slides and make sure you all can see them.
And Linda, we did miss you. So Linda, would you like to introduce yourself?
Where's she at?
Sure.
Oh, there she is.
I work for a nonprofit in Northern Michigan doing substance misuse prevention, and I've been doing coalition work on and off for 7 or 8 years, I guess now. And Doreen described me to a T when she said, don't give up, because it's been a struggle. So I'm looking forward to learning some of your tricks of the trade. And, I feel like I've got some new life behind me with this Prevention Network grant that we've got for coalition building. And I feel like we're on the right track now. So I'm looking forward to hearing what you have to share.
Okay, thank you.
Thank you. I do appreciate each one of your experiences valuable. And I refer to Ms. Doreen as an expert. Each one of us is an expert in our own life experience. And so when we're talking about individuals, don't discount what you would consider either a success or a failure. If it was a learning experience, it was not a failure. So part of our meeting agreements as we go into these workshops is to understand that we are all working for a culture of growth. We want to strengthen our existing networks. We want to facilitate change in ways that leads us to healthier communities. And so for each one of us, would you go to the next slide, please? For each one of us, as we are progressing and growing, we need to be humble enough and brave enough to give and receive feedback. So 32 years of experience, 32 days of experience, wherever you are, you have value and we appreciate your insights. And so we all are sharing this purpose of building a culture of growth. We're only going to get there through honesty. But if anyone chooses not to respond and engage, this is challenge by choice. So it's okay if you process things differently. You need to take it all in and listen without engaging with the material just yet. So Doreen and I are both available after this. You'll have our contact information contained in the slides. I encourage you to reach out because we are working on building an ongoing growing network. And it's not just about a one-stop lesson. So please continue to engage with us as we go. Our objectives for this evening are to understand why we form coalitions. You know, when we're talking about the strategic prevention framework, when we're talking about coalition building, you need to start from the perspective of a 4-year-old and always ask why. Why? Get to the bottom of it. Why are we doing this? If you don't know, you need to go back and understand your why before you start building a coalition. Doreen's going to explain to us some of her experience with the history of coalitions pre-CADCA. We'll explain what CADCA is, but it's at any point, if we start using words or phrases, specifically acronyms, which you don't know, please drop a note in the chat box or just interrupt and ask that question, because that's one of the pitfalls of social work, is that we use acronyms all the time and folks who are newer to the field don't know what we're talking about and then feel shy about speaking up. So CADCA is the Community Anti-Drug Coalitions of America. It's a national group that we'll talk about a little bit later. We're also going to be very basic and talk about the definition of prevention. It can mean different things, so we're going to talk about it within the public health model. We're going to talk about the difference between a program and a coalition. Oftentimes, people get into a mindset where they're implementing programs and they miss the forest for all the trees. And then lastly, we're going to make sure that we understand why it's important for prevention to take the form of both individual and environmental strategies. We cannot hope to change our environment if we're only addressing the behavior of individuals. So we'll get into all of that. And I think we're going to set clear expectations here, just that your role is to be authentic, humble, humorous, and curious. Ask your questions. Don't be afraid to laugh at us. If we make mistakes, we'll do the same thing. Give and receive feedback with grace. So your feedback is always welcome. We do have a feedback survey at the end. We're going to share with you. I think it's 5 questions. It'll take 30 seconds. What is shared here is recorded. It's not confidential. If you want to have private conversations, give us a phone call, send me an email, and that's it. So,
oh, you got a little bit more.
all right. So we're talking about Miss Doreen and I had a couple of really good conversations, and a lot of times, what are those things that you think we need if we're trying to start a coalition? Linda, if I had asked you 2 months ago, what do you need to start a coalition? You would have said what?
Probably people.
All right. What else? Training, maybe?
Well, definitely training and a framework, something that I could work from.
Right, a plan, right? We need people, we need training,
Right.
we need a plan, right? So the third thing that we usually hear from folks is funding. We just need more money to be able to do the work we want to do. So what we really need, we need to start with trust. We need to start with an understanding that we care about the people we're serving. We need to put people first. And I've said over and over again that prevention is all about relationships. And so what we need is to start from that point of trust, to have some shared understanding of what our priorities are, to use that understanding to develop relationships that are not just I'm providing a service, not just one-way relationships, but two-way relationships, so that people become more engaged in the solutions, in implementing the solutions in their own communities. So we need to value and develop those two-way relationships. And then we do need that structure that Linda was talking about. She's been working with me for a couple of months now, and so we're on the same page with needing a structure. But we need diverse experiences, we need different viewpoints, and we need to align those in an honest environment where we can be humble enough to give and receive feedback, to be heard. And that's why we start a coalition. That's what we need to start a coalition, is just that honest space where we can trust people and start having those conversations about what we need. So I want to dazzle you for a minute. This is a stone that my dad cut. When we're talking about cutting stones, that's the terminology, but it's a faceted stone. And so when we're talking about this is the same stone, top and bottom. And what we need when we're talking about coalitions is an understanding that the issues we're facing have to be addressed at different angles, at different levels, just like you would facet this stone. We cannot come at a problem from one direction and assume that if we grind away long enough, that we will get a nice product. So we need to be able to address this from a lot of different angles at a lot of different depths so that we can work together to create something more beautiful. So I just wanted to do a quick shout out to my dad, Tom, and thank him for allowing me to use his photos for this.
All right. I just want to give you a little background of the EZ. That's what we call it, EZC. When we started, we was Empowerment Zone Community Prevention Coalition. And when we were working with a media person, they said, that's just too long to promote. So we shortened it to Empowerment Zone Coalition. We were formed back in 1996, and we were established as a 501c3 nonprofit in 1999. The community felt strongly that we should continue. Some people thought that we wouldn't last past 3 years, the grant that we had. But the community was really vested in it, and so we sought a 501c3. We're licensed by the state of Michigan to provide substance abuse prevention and treatment services. The recipient of the 2000 Outstanding Coalition Award by Community Anti-Drug Coalitions of America, CACA. We were the first coalition in Detroit to receive the Drug-Free Community Support Grant. We've been an active member of CACA since 1997. So we've seen a lot of the changes that CACA has gone through. We've even helped them to form some of the things that they do now. The National Coalition Academy, myself and some other leaders and mentors were part of that group that helped them to form the academy that they're using today to train coalitions. And then we're funded through several different places. Detroit Wayne Integrated Health, which we call DWIN, that's Region 7. Prevention Network, we also funded through the Center for Disease Control and Prevention, CDC, which is where the grant, the DFC grant comes from. When we first started with the DFC, it was out of OJJDP, which is the Office of Juvenile Justice and Prevention. Then it went over to Center for Substance Abuse Prevention, and now it's under CDC. I wanted to start with the definition that we now use through CACA. It's where it's the formal arrangement for coordination and collaboration. The key in this definition is where it says in which each group retains its identity, but we all agree to work together. So when you get people coming to your table, you don't want them to change who they are. You want to find those commonalities that you all can work on. And they, as well as the coalition can claim what they're doing, everyone at the table can claim the activity because you're all working together on that activity. So when they're doing their reports for their agencies, they can talk about how they contribute to what the coalition is doing. That also attracts people to your table because it helps them to get their job done as well as help the coalition. You know, you're maximizing your resources when you come together and work. So I encourage you to be able to figure out at that table how you can collaborate as individuals in different sectors in the community.
And that definition includes resources, which is a key component of what the C3 programs talk about, because we have to bring people to the table who have resources, and that includes their personal experience and knowledge. So it's important to understand that people are the key resource, and each of them has access to other resources, but we're looking really at the people as the highest value.
And how we operate is, in order to take resources away from the table, you have to bring resources to the table. You want to create that level playing field, that win-win situation, that everybody who's coming to the table feels valued and feels that they have something to offer coming to the table. Coalitions are designed to move quickly. Sometimes we can't. It depends on how we are structured. Some of us have been structured in agencies where we have to follow the chain of command. Others, like our EZC, we are a 501c3, so we have a board, but our board allows us some latitude when it comes to issues in the community. So the thing you have to figure out is how you can operate within that system to still serve the community. We do multiple strategies across multiple sectors, meaning that when we bring those sectors to the table, there is something that they can do within their own discipline to reduce substance use. And so when we bring them to the table, that's what we try to figure out. If it's a law enforcement, what is it that law enforcement can do to reduce substance abuse? Oftentimes, you know, I'll tell some of our officers, you can't law enforce your way out of this problem. We have to all work together because you want people to see the officers in a positive light and not always see them when they're arresting someone. That's how it gets uneven sometimes in the community. So if we can bring the officers to the table and they're participating in other activities where people see them as being more approachable, then we can bring down some of those walls that people have around law enforcement. And that's just one example, but you can use that for every sector that you're working with. There is something that sector can do. We're designed to reduce risk factors and increase protective factors. You have to look at what goes on in the community. You know, I'd say a few years ago, CSAP, Center for Substance Abuse Prevention, changed their model. They used to say high-risk youth, but now they say youth in high-risk environment, because almost every youth is exposed to something within their environment where they can consider that would affect them in being high risk for use of substances. A lot of the language has changed over the years. So sometimes that can confuse people. You know, we use one of the things, the 7 strategies of community change. Now I see some places it says the 7 strategies of behavioral change, but they're the same strategy. You know, so I often say that when you're new to the field, don't be afraid to ask us. That was the biggest thing that confused me when I came into substance abuse. And that was the terminology. You know, so I started asking people, okay, well, what do you mean by that? And because sometimes we know it under another name, you know, it's the same thing that we do, but they've changed the language. So I encourage you to continue to ask questions And we're also designed to implement environmental strategies. Now, over time, it has changed a little bit. Some coalitions do treatment, some coalitions do direct service, but originally when we started, we were designed only to do environmental strategies. That means we use a broad-based approach in raising awareness and mobilizing the community, whatever issue that you're dealing with. And for us, it's substance use disorder. So we would do campaigns, we would do all kinds of things that would drive people to the direct service program.
Now, I did drop in the chat a brief one pager on each of those strategies, a one pager for the Center for Substance Abuse Prevention strategies that we're using for the C3 programs, as well as those 7 strategies for strategic planning from CADCA. So when we're talking about different strategies, there's a handful of people on the call today that are not actively working with the C3 programs, so that we're all on the same page. Those documents are for you to take a closer look at after the webinar is over today.
Okay. You said, why do we form coalitions? A lot of times it evolves out of a need. You know, you have people who have a passion in the community. Using the example, they get tired of seeing drugs in their neighborhood. And so they figure they need to do something about that. Now, we're not saying that they know all of the things that we know and the skill building that we know. They're just wanting to do something. They have the passion. So then they will rally people to come together. And then they learn some of them other things that we've learned. But if they have the passion and persistence, then other people will help them who have the skill and the knowledge. It also, we form them to expand the scope and range of services. You know, oftentimes, you know, we get funded, but we may not have enough funding to do what we need to do. We may not have enough human resource to do. But if you pull people together, you bring together more resources, more knowledge, more skill to the table, and then that helps you to get the job done that you want to do. You know, you can also influence education, resource development, and advocacy, because, you know, strength in numbers. You know, when you're going to present at city council to let them know what you're doing, now keep in mind, we're not lobbying, we're educating and we're advocating. Those are the 2 things that we do most in coalition building. But if you bring a whole group of your coalition members into that room, they're more apt to listen to you because that's their constituents. It's not just you coming in saying that this is what you want to see changed. It says, another reason we form coalitions to avoid duplication of services and filling the gaps in services. You know, that's one of the things we're designed to do. We look out there and see what is not there. When we were doing coalition building years ago, there was no parenting program. And so we decided to start a parenting program. We called it Parent Power because what we discovered is parents, if you invite them to a parenting program, they think they don't know how to parent. So they won't come to the program because they think that you're telling them that they don't know what they're doing. So rather than calling it a parenting class, we called it Parent Power. And we provided resources to get them in the room. And once we got them in the room and we were able to talk to them about parenting and say to them, you know, babies don't come with a manual. You know, I often use myself as an example. Had I not had my mother and my sister, my child would have been a guinea pig. I didn't know nothing about raising children. I had godchildren, but I didn't have them every day. So they helped me to make sure that my daughter stayed on an even keel, because, you know, that's how you have to do it. You have to get people to the table first before they can hear you. It creates more recognition and raises the visibility of the coalition. So you become sort of an expert on the subject. So people in your community, media will start calling you when there's an issue because they see you as the people who know about the substances in your community. And coalitions accomplish what no single organization can do. That means when we come together, we are a stronger force to be reckoned with. And so that's why when we go to CACA, to the leadership forum every year, it's usually in Washington, D.C., and that's because we take this Hill by storm. We go to the Hill and educate our legislators on what we're doing in our various communities. That also helps to keep the money flowing as it relates to the drug-free community support grant. Sue Thaw is a lobbyist for CACA. She is actually hired to go to the Hill every day and to advocate for substance abuse prevention, treatment, and recovery. And then how we enforce and support her is by giving her the stories of what we do in our community. And she takes this big old book, she rolls around the halls and show the congressman why it's important to continue the drug-free community support grant. That is the only grant that gives, besides Prevention Network, that gives our coalition funds to do environmental strategies. Oftentimes in Michigan, prior to now, most of the funding went to direct service. So many of the coalitions back in the 90s couldn't get funded because they didn't do direct service. So now that we know that we need all of these different components, we need individual programs to direct service, and we need environmental strategies also to drive people to those programs.
We're going to jump into the history and then a little more, but we're going to talk about what we mean when we say environmental strategies. But absolutely, and we're seeing that shift across the board, not just with Prevention Network and with DFC, but recognizing that school-based prevention programs are one aspect of a bigger picture. We want to saturate the entire community with good positive prevention messaging, with those policies that support good relationships with law enforcement, with public health messages that are impactful and are received well by parents and others. So we're recognizing that we need to have a broader scope and not just focus on individual behaviors, because believe it or not, we all exist in an environment.
True. A bit about the history of coalitions, like she said, pre-CACA. When I started out in coalition building, I went to a Society for Public Health Education. That's what SOPHE is, for those. And I went into a presentation on coalition building. At that time, Diane Allensworth was the president of the School Health Association. And she was bringing this concept that you could put diverse people in a room and actually get something done. And I was so fascinated with that. I went up to her at the end. I said, "You sure? You sure you actually can put people in a room and they're gonna do something?" She said, "Yes." So I got so intrigued. I was in the master's program. I went back and I told my prof on letting me do my thesis on coalition building. Did I know there was hardly nothing out there on coalition building. She was leading the way. She was the pioneer to talk about coalition building. So, you know, I tell students, always ask, because people want to see students be successful. So if they can, they'll help you. So I went back to Diane Allensworth because I had a card from her. And I said, "I am a student at Wayne State University and I'm trying to do my thesis and I cannot find anything on coalition building. Can you help me find where I can find at least the resources or the journals that it might be in?" And she looked at me and she said, "There is not much out there, but I tell you what I'll do." And I said, "What?" She gave me all her unpublished data to be able to write my thesis. So I always tell college students, go ask. And I agree that I would not use any of this or publish any of it. I just would use it for my thesis. And that's what I did. And so how I got into coalition building to actually implement it, what I had learned is that my the professor that taught all of my core classes, he remembered me. And when it came time for him to build a coalition, he called me up and said, would you like to put that skill into action? And I said, what? And so I built my first coalition in 1991. It was called By Our Own Hands. It was for 9 to 13-year-old African-American youth. And we went national. It was in 21 cities. And our children out of Michigan went, they were the poster child on the brochures and everything. And so that's how I started in the coalition building. And before the next set that came was from the Center for Substance Abuse Prevention, they had a grant for partnerships. Well, the partnerships did exactly what we did, and that was coalition building. They were funded for 5 years, and they were actually the lead when it comes to what we learned when they released the the coalition demonstration grant from CSAP. But I often tell CSAP, because I'm one of those people that will tell you the truth. So CSAP asked me to do a presentation around coalition building, and when I talked about the partnerships, who were funded for 5 years, but then when they came back in 1995 to fund coalitions, they only funded us for 3 years. And I said to them, I don't know whose idea was that. When it took the partnerships 5 years to get off the ground, why did you reduce it? You think we learned so much that we need those other 2 years? And so we came behind and had the demonstration project. But keep in mind, all of the partnerships and the coalitions, they were evaluation driven in their own way. They found a way to quantify what we were doing in coalition building so that we could continue to advocate for funding. Because one of the things that they wanted the coalition demonstration grants to prove is that coalition building was a viable vehicle to reduce substances in the community. This is what Ruth was talking about, definition of coalition. When CSAP started prevention, they weren't really sure that there was a definition that would apply to all of it. So what they came up with was this definition in later time. Is the sum of our efforts to ensure healthy, safe, and productive lives for all Americans. We want to construct lifestyle and normative, discourage drug use. And we can do that in various ways. We want to promote and change the social environment. That's where social norms come in. I often use in the African American community, in some instances, alcohol is part of our celebrations. And as the years gone on, people are learning that they could still have fun, but reduce the amount of alcohol that were in the parties that they do. Mm-hmm. Because it came a point where people were leaving, say, bars and things, and they were intoxicated, and then they get in an accident. So that's where it came, where we started advocating for bars to reduce or making sure that if a person is intoxicated, they don't drive. They don't drink and drive or drug and drive. That's where some of those campaigns came from, out of the necessity, Mothers Against Drunk Driving. It was mothers who were passionate about people getting in accidents and really hurting and killing young people around substances. You know, I had a friend that her son was starting his first year in college at U of M. He went up, dropped off his stuff, came back home to get some other, and on his way back, a drunk driver hit him head on and killed him. And so oftentimes that's how campaigns and coalition issues are enacted because of someone's passion. They turned their tragedy into something good by advocating to change the laws around drinking and driving. You know, prevention also reduces the risk factors and increase protective factors. That's what we do in coalition building. Prevention is rooted in the public health model. And it has, you know, described in 3 levels for us, public health. The public health model is a staple under the model addresses health and social problems in a comprehensive way. That's how they want us to do when we do coalition building. We're not just looking at it in one narrow way. We're looking at it comprehensively. What can we do? What are the root causes? How can we identify the harm and what's going on in an environment that we possibly could contribute to changing? You know, we got to recognize that we need those multiple strategies. You know, we got to educate. We got to do sometimes public policies. We got to make recommendations. We can't expect our public officials to know everything. We sometimes will sit when they make recommendations as to why did he do that? Well, that's because he don't know. So it's up to us to advocate and educate them on substance use and why we advocate that young people should not be able to get a hold of substances. Oftentimes people don't understand that you say that marijuana is not directed at kids, you know, it's 21 and up. But we know from experience that if there's an increase in social acceptability among adults, there will be an increase in use among youth. Because they say, okay, well, if the adults think it's okay, then maybe I'll go ahead and try it. So some of those young people that may have been riding the fence saying that I'm not going to do it because the adults are not doing it. If that changes and they become socially acceptable, then some of those individuals will try it. So the public health model helps us to look at that in positive ways and how to intervene. You'll see the model in various ways. This way is one of the easiest ways to understand it. It identifies the problem, and I apologize, I don't know why this slide is a little blurry. It identifies the risk and protective factors, and then you develop and test your prevention strategy, and then you assure the widespread of adoption of whatever that strategy that you're implementing. You can use this like for campaigns. This source came from CDC. Now the one that is more recent that Ruth helped us find is the public health model, is using it as a triangle. Is the agent, which is the substance, the host, which would be the individual, the environment is the condition. And then if you want to put it in the terms of substance, you can look at it this way. So as the agent, if the agent is substance, we sometimes will have to do policy around it. If you look at it from the standpoint of the host, as an individual, you may have to do skill building, education around it. And in the environmental, you might have to do some change in community norms. Now, it's not always easy to change community norms. You have to be persistent to get people to change behavior. You know, you can't do it in a year. And sometimes they think we can, but we know we can't do it in a year. We can change attitude, but we cannot change the norm in a year.
I think anybody who's worked with youth knows that consistency is key and it takes time. So just develop that from a point of trust. And I do want to mention we're about halfway done with our time tonight.
Okay. I have a lot of slides, so if I don't get through them all, you already have them. And you're welcome to call me if you don't understand anything on the slide. This is the basic premise of prevention. These came from CSAP. Years ago, they gave us a book on prevention, and these are part of what they felt was necessary to have in prevention. Of course, comprehensive. They wanted for you to do comprehensive strategies, whether to reduce individual or environmental risk factors and to increase those protective factors around high-risk populations. What will always creep up in coalition building and prevention is community involvement. Because sometimes we are far removed from the people we're trying to serve. If we don't include them in the process of planning and implementation, then we may be creating things that they won't even participate in. Because one, the community may not be ready. You will know that if that community comes to your table and say, you know, we might be able to do this part, but this part is not going to work in our community. So you need that community involvement and have people engaged in what you're doing so that when you create something, they take ownership. You know, they will take ownership over what you're doing because they were part of creating it. They want you to have it intertwined in the general health care. I often did not understand why they saw substance abuse different than any other public health issue. But it seems that people separate substance use away from other public health issues. And so it's up to us to make sure that it's included in other public health issues so it gets the same attention that other issues do. And prevention approaches and messages should be tailored to different populations. So you don't want to create a campaign that you want for adults and think youth are going to pay attention to it. That's not going to happen. You have to meet them where they are, and your campaign should be directed, and they're the most effective when you can really tailor to your audience. This is how we see prevention and public health. CSAP really focused on primary prevention. So really looking at it before people initiate substances, particularly our youth. Secondary would be that they've started to experiment and you're trying to keep them from going any further. Tertiary, they've already engaged in the behavior and sometimes severely, and then you're trying to keep them from relapsing or rehabilitation. Now, oftentimes they didn't know tertiary prevention is included in treatment. You know, I tell treatment providers, why do you think they call it relapse prevention? It is a part of prevention. And they just never thought of it that way. They see it as treatment, but in actuality, it is a part of prevention. Most of the time with coalitions, we focus in on primary and secondary. Tertiary, we tend to leave that to treatment unless they invite us in.
So we're seeing that shift a little bit in Michigan right now too, as recovery and treatment and prevention are working together. Prevention is being more included with recovery supports and involved a little bit more with family cases when we're talking about treatment. It's a good shift.
This is how prevention is seen within the continuum for the Institute of Medicine. We have promotion, and we have prevention, which is utilizing universal, selective, and indicators. Then it moves over to treatment and recovery. And as Ruth said, prevention is starting to help with recovery support services. And for those of you that are new in the field, this is the definitions of universal, targeted, and indicated. You're looking at the entire population, and your messages and everything is aiming towards that. Targeted, you're looking at a selected group of that population or a subset, and you're trying to impact that particular group. Indicated, there may be exhibiting some problems, and so that you're trying to target in on them with the early signs of those problems. And you come to the minimum prevention data set. See, when it started, it was just called the minimum data set. So we called it MDS. Now we have to call it MPDS. So it's the minimum prevention data set. This is where all that comes into play, because you have to look at the various strategies in order to put your data in the minimum prevention data set. There are some differences between programs and coalition. I'll just share a few with you. You look at this coalition, we're designed to scale up. That means we look at it from the standpoint of community level indicators and looking at strategies that impact. I meant to change that. Entire. I left out the R. So y'all know I'm human. I just want to see if y'all paying attention. And so you're looking at the entire community, and your coalition outcomes will look at both short-term and long-term. On that same vein, if you're looking at programs tend to measure changes in individuals who have been directly affected by the intervention. When you're looking at coalitions as it address multiple causes, to look at several different problems in a community, we want to see what the root cause is, what that risk factor is, and see if we can do anything to change that or reduce it. Oftentimes they'll say, well, there's so many coalitions out there. How do you know whether what you did made a difference? How do you know? The only thing you can say is you contributed to. You contributed to, and if you do a community assessment and you stick within an area, then you would know how much you have contributed to what you're doing. So that's why it's always important to do your community assessment, your satisfaction surveys, so that you know how the community and the audience is perceiving what you're doing and what do you need to change or improve upon.
So a quick plug, if I can interrupt for just a second. We are going to focus on community assessments for beginners on November 9th at that capacity building workshop. So there's a lot to all of these, and it is an entire system. If you have more questions about assessments, we are going to get into that, but it is critical that we understand that we need to target and be laser focused on something that our community is ready for us to change and that we have the capacity to change. And so those parts are critical. So I just wanted to interject that and put in a plug for November.
All right. Your programs tend to focus more on single strategies. So like parenting program, peer mentoring, they focus on the individual in a direct service, what I sometimes call the end user. So if these are individuals who are using or experimenting, sometimes your programs like, what is that program? Was right off the tip of my tongue. BOTVEN, skills, life skills, that would be focused in on a program. It's an evidence-based program. that will be implemented for individuals. Coalitions tend to look more broad-based. What can we do to change those norms and those social conditions in the community? And, you know, we're actors. Coalition activities are infused and taken in by all the members. You know, oftentimes we say we want to work ourselves out of a job. You know, that's what we're designed to do. We're designed to get the community to institutionalize what we do, train them to do it. So if the funding and we're no longer in existence, they can continue. We did mini grants at one time where we would offer mini grants. And so we trained the grassroots how to do mini grant writing. We taught them how to budget the money and not to commingle the money into other things that they were doing, like an example of a church. Church has a general fund. Well, we taught them that they couldn't put that money in the general fund. It had to be a separate pot. Then how we were able to train them to do it the correct way, we would give them funds, and then they would have to bring the receipts to prove that they spent that money, and then they could get the other half. And so by training them to do that, some of those churches kept their youth programs going after we could no longer fund them. So it's that old adage, you know, if you teach a person how to fish, they would feed them for a lifetime. That's what we want to do with coalition building. But sometimes we can get discouraged because we don't see no end to substance use. Every time we think we got a handle on it, then they come up with something else like rainbow fentanyl, which we have to address now because it's coming up to Halloween. So we need to alert people about the new things that are hit the street that could potentially be targeted towards young people and young adults. You know, program staff lead the process and are responsible for implementing. Where in a coalition, we try to get everybody involved. We are just the facilitators. We coordinate and we support, but we really try to get the members at the table to actually take the ownership around the projects. This is just a little tidbit of fact that NIDA said drug abuse is a preventable behavior. The numbers are probably a little bit higher now, but you know, each year we were spending $740 billion. You know, preventable healthcare, law enforcement, all the things that are affected when someone is using and addicted. This is the cost. You know, prevention is cost effective. That's what we need to keep pushing home. That CACA figured out that for every $2 that we're spending on prevention, $20 were the benefit of that. So if we can continue to show that we're cost effective as preventionists, my hope is that the funding would increase because we're able to do more with a little. So why do we use coalitions? Somebody's at the front door. Sorry about that. Somebody in my front door. Why do we use coalitions? Is, you know, we break through community denial that way. We were training coalitions in Fairfax, Virginia. They came from all over the country. And one lady was just sitting there. She wasn't saying anything. I'm like, okay, how do I engage her? How do I get her to talk? So finally, I asked the question about, how's your community doing? To her, her community didn't have a drug problem. So that's why she wasn't engaged in any of this. She was in denial that there was even a problem. And so rather than to say to her, yes, they do, I said, well, where did that data come from that's in the middle of the table? Because each community had to bring their data as it relates to what was going on in their community. She picked it up and she looked at it and she says, well, it says that we have this and this. I said, that's your community. I said, so you do have a drug problem. And so then that's when she keyed up to learn the strategies of how to do things. But a lot of times people are in denial. You know, it's not my kid. My kid ain't out there using drugs, you know. And so they will tend not to listen to what you're talking about. You know, we have to represent consistent, sustainable, strategic efforts. We have to constantly look at the data. You know, we can't do a lot of this without really going to the data first. And sometimes the data is not there. Sometimes we have to generate that data ourselves by going out and doing our own survey. In Detroit, they don't do MiFi, which is public health.
The Michigan Profile for Healthy Youth.
Thank you. You know, they don't always, you know, we in Detroit, the superintendent don't do it in all the schools. So if we really want to find out, we have to go out and survey some of those schools. We can get some of the principals to let us in, you know, to do the survey. And so we would do the surveys ourselves, and then we got data. Or we'll be innovative. We have the Aquatic Center. Now the kids are wet when they do it, so we have to cover up sometime, but we get the data because if we give them something for filling out the survey, they'll do the survey. And they're a captive audience because they're in the Aquatic Center, they're not gonna leave out, and they're there all day. So it's a good place to go collect data. You know, you design a comprehensive strategy once you have that data. You know, you look at, okay, well, we're having a problem over here with marijuana. So now we need to do a campaign for youth around marijuana. And we find that out from the data that we collected, both whether we collected it ourselves or we're using the MiFi data or some of the other data sets that are out there. You know, we're trying to change community norms. You see that come up all the time, or sometimes now they call them social norms. So what is that campaign that came out of Ohio? Those who host lose the most?
Parents who host, yeah.
That's a social norming campaign, a community norming campaign. What they discovered is that some of the parents were giving their kids alcohol as long as they stay home. You know, I think they indicted one of the execs of one of the big three because the wife was allowing the kids to drink alcohol at her house. You know, what you do with your own kids is something different than you inviting everybody else's kids in and they're doing it. And those parents are not aware of what's going on. So that's where that campaign came up, those who host lose the most. And then we brought it from Ohio into Michigan. And you know, we share things in coalitions. We're not territorial. If I have something that you can replicate, you know, in your own community, we're welcome to give it to you. We did that with the Georgia Medical Society. They had this whole campaign that they created around prescription drug abuse. And I was in their workshop at CACA. I just went up to them and asked them, can I replicate that in Detroit? They sent me everything that they had. And I told them I would recognize them. So at the bottom of our stuff, it has adapted from Georgia Medical Society. You know, that's all we have to do.
I do want to say that you have to stay in touch with those folks if you're using their curriculum. The parents who host lose the most, that's been updated recently. So if you're using that in your communities, get back in touch with Prevention First in Ohio and check in with them on a regular basis and make sure that you're using the best, most updated materials and continue to work with everybody else and build your networks up. Because if we just take one thing from here and another thing from there, we might not be implementing those programs with fidelity. And that's pretty important if we want to actually shift the needle, if we actually want to see a difference.
And all of the evidence-based programs, they can be adjusted, but you have to go back to the developer to do that. Because if you don't, like she said, you won't know whether you're really getting the impact that you should be from that particular program. I tried to get them to go research strategies and research models, you know, because we have a lot of public health models that we can also use to prove that programming works. You know, coalitions, these are some of the things that you want to look at when it comes to coalition. You know, it provides a common forum for diverse members. You know, it fosters development of trust. You got to have trust at your table, because if you don't have trust and rapport with the people that you're dealing with, it won't work, because it'll be too much conflict at the table. You know, you want to get out those hidden agendas. What's going on? You know, you want to reduce the fragmentation and the duplication of services. You know, because sometimes we all overlap. Like, give an example of doing the Take Back Day. If we're all doing Take Back Day and we all trying to do it in the same place, then we won't be as effective, because we need to spread it out all over Michigan when we're doing the Take Back Day. So those are some of the things that when we're looking at coalition building. This was one of our coalition meetings. They were actually sitting there and going over, you know, you want to better coordinate in the coalition. You know, you want to mobilize. You know, you want to get as many people at your table as possible. Because even though with the drug-free community support grant, they said you only have to have one member of those 12 sectors, things change. So you're always recruiting. You're always recruiting people, because, you know, some people are at the table because their organizations say they have to be there. Okay, well, what if that individual leaves? Then there's nobody else at the table, because the other people at the organization didn't know anything about your coalition. So you constantly are trying to educate and raise the visibility of the coalition. So you're constantly getting people in, so that that you do not lose. If you're doing those 12 sectors, you don't lose a sector because you didn't have somebody to take that place. So you're constantly recruiting all the time. This is just some of the strategies that we do. These are our billboard campaigns. When I heard them talking about one pill can kill, I said, I wonder, did they see our billboard? Because this billboard was up way before they started talking about fentanyl. And so, but they're using this slogan now, one pill can kill. I heard it on the news the other day. So this was one we did around prescription drugs. This one we did around prescription drugs. This one was around marijuana. And we came from the standpoint of, it was the Marijuana Youth Prevention Initiative. So this was the second one we did. We had a young lady that created Detroit, Love Detroit Coalition. They do with their youth 6 words. And so the youth come up with 6 words that would have some impact on reducing substances. And one of them came up with that, I can't remember exactly how it went, but it was around poison ivy. She was saying, oh, they said that marijuana is natural. And she said, so is poison ivy. And so we took that slogan and put it up on a billboard. And we gave her credit on the billboard. And so every time she passed the billboard, she saw her name on the billboard. So, but we did that. We have gambling funding. So we raised the visibility of the Prominent Gambling Line. So we not only do the billboards, I like to try to use the billboards in our neighborhood we've got the billboards where you can walk past them. I know sometimes in other communities, there's not as many billboards. We have a lot of them in Detroit. So I tend to use what we call the 8 sheets, where people walk past them. The other ones are more expensive, but we were able to get a gambling digital billboard. You try to use everything that would draw people to learn about your coalition and the work that you're doing. So we did a Come Walk With Us program. So people like to walk in the wintertime, but they have nowhere to walk. Samaritan has a track. So we asked Samaritan to allow us to use their track on Saturday to do a walking program. And at the end, they all got t-shirts that said, come walk with us. And so that raised the visibility of the coalition. You know, we used funding that we had raised to be able to do that. You do community engagement and cleanup. You say, what does cleanup got to do with working with your coalition? Okay, look at all these people. These people came from all over to help clean up a neighborhood. And all of these people knew about our coalition when they left. And they came from all over the country. So not only did they learn about our coalitions, but now we're directing them to go back and find their coalitions in their areas. So we're constantly doing things that will help. This community initiative was all of the kids who lived in this neighborhood. They placed their hands on the sign and we put it up at the end of the block. So that built pride for them to stay drug-free. So you use all kinds of innovative things that you can think of, and it don't always have to be expensive. Visiprint will give you these. We just put it on a postcard and just reproduced it, You can do things where it doesn't cost a whole lot of money to put the word. And every time we do displays, we would use these billboards and we would use these literature. Here's some special projects and collaboration. For National Drug Fact Week, we got Bustle Family Center, which is part of our Detroit Department of Parks and Rec. And their kids created signs. These kids were awesome. During community talk, the town hall meeting that the Center for Substance Abuse Prevention, they'll give you, I think, $500 from the federal level to do this campaign on underage drinking. And you decide what you're going to do. These are middle schoolers that did a play. And they were awesome when they did their play. They did all of their, what do you call it? Stunts and all of the, what do you call that? Where they, create their own props.
All the props.
Yeah. And one time they created their little car that they could crash. So they were very innovative in doing the age drinking town hall meeting. So you can partner with other people. This is some of their display. It's no longer called Kick Butts Day. It's Down with Tobacco, isn't it? I think I like Kick Butts better. And they created this in the lobby of Bustle Family Center. And so everybody who came in the center got educated around cigarettes and the reduction and why they need to reduce. And each kid did their own little paper t-shirt to say why it should be reduced. So you can get other people involved where you don't have to do a lot of work, and they will help you to come up with ideas of how to spread the word. So that's why I encourage you to get as many people at your table as possible, because they will help you to come up with these kind of ideas. And then just a little shameless plug. We have 2 workshops coming up with Albert Gay on October 27th. We have Engaging Youth in Your Community and Coalition Work. You can register on Eventbrite. I'm going to send these to Ruth so that she can send them out to you. There is a link at the bottom of the flyer that tells you how to register. And then on November 1st, we have Understanding Health Disparities and its Impact on the Community. And this is one of my favorite statements. Never doubt that a small group of committed citizens can change the world. Indeed, it is the only thing that ever has. And that's Margaret Mead. Together, we can make a difference, but we just have to keep working together to be able to do that. I thank you for taking the time out to listen to us. And I hope that some of this will help you to stay energized and inspired to continue to do your coalition and capacity building. And Ruth, I'm going to turn it back over to you.
Thank you. I understand that I've had several opportunities to visit with you, and not everybody has. And I just want to give everybody the chance to say thank you in the chat or unmute yourselves. I also at this point want to encourage you to ask questions. So I've dropped the feedback survey, that 5 questions, in the chat box. If you could go ahead and click on that link or copy it for now and complete it in the next hour or so, I'd really appreciate that. For everybody who registered, I have your email address, and so I'll be sending you an email tomorrow morning at 8 o'clock with the attachments that I dropped in the chat earlier, as well as the flyers that Doreen shared. There's no shame required when we're talking about promoting Albert Gay's his trainings that are coming up. It's critical for us to understand the social determinants of health when we're talking about prevention. If we don't understand why people make the choices that lead to sometimes putting themselves at risk for developing a substance use disorder or other health behaviors, we have some problems. And so we have to have that basic understanding of what else is going on in this person's environment, in their life, in their family structure, that is leading, that is creating that path toward unhealthy behaviors. So just to reiterate, your next steps, depending on where you are right now, we want to meet people where they are. So always we're continuing to develop and build trust with people in our communities. And you can't do that without being in your community. So get out there, spend time with people, engage in conversations, be humble, be open to understanding new perspectives. Just because I have a different experience doesn't mean that the other person who sees it a different way is wrong. So when we're talking about continuing to build coalitions and capacity building, we want to understand the priorities of our community. So from that trust, we can develop an understanding. And then once we understand better, we can continue to develop those valued two-way relationships. And then, as you can see in the comic on the right, a miracle occurs, right? Then a miracle occurs and we have a structured and aligned yet diverse collaboration of humble and sincere folks. So what we're looking for here is to get from step 3 to step 4. Bye, Paige, I know you said you had to log off. We're going to continue digging into this in the future. So we're going to look at what happens in the middle there. I think you should be more explicit here in step 2, where it says in the comic, I think a miracle occurs, right? So we're going to dig in deeper. We'll see you in 2 weeks from today. So October 19th, you do need to register for that separately. So please go on to the preventionnetwork.org page and go ahead and register for that. So thank you very much, everybody. This is my contact information, and I am going to zip my lip for 10 minutes and we can just talk and have questions.